Hello, ladies and gentlemen. Today, I'm going to be speaking on heart disease, giving an overview on heart disease. Let me start by telling you a little of Eastern Circle Incorporation. Thank you for tuning in into our monthly health corner. The ECI, Educational Health Corner, promotes health awareness in the educational community, targeting age 18 years and older. ECI focuses on health promotion, disease prevention, and chronic disease management. Resources include informative articles, workshops, and interactive sessions to engage and empower individuals. By fostering collaboration, the initiative creates a supportive network for better health choices. Its holistic approach aims to enhance overall well-being and health literacy. Ultimately, it seeks to cultivate healthier habits for a better informed generation. So let's start with the heart disease, giving an overview of management symptoms. Eastern Circle Incorporation Health Educational Corner. Let's begin. Main points. Why is knowing about heart disease important? Define coronary artery disease. Risk factors for coronary artery disease, symptoms of coronary artery disease, treatment and prevention of coronary artery disease. That's the main points we'll cover today. So let's begin with statistics on heart disease. Heart disease is the leading cause of death in the United States. About 695,000 Americans die from heart disease each year. That is 1 in every 5 deaths. It is important to keep your heart healthy. Keeping your heart healthy is one of the important ways to make sure you are feeling well and at your best. Heart disease is very serious. It's a very serious problem that keeps the heart or blood vessels from working properly. The function of the heart is to pump blood throughout the body via the circulatory system, supplying oxygen and nutrients to the organs and removing carbon dioxide and other waste. There are different types of heart disease. Coronary artery disease affects the arteries that supply the heart. Valvular heart disease affects the valves in the heart function to regulate blood flow in and out of the heart. Cardiomyopathy affects the way heart muscles squeezes. Heart rhythm disturbances, that is also known as arrhythmias, that affects the electrical conduction to the heart or in the heart. Coronary artery disease, we are going to speak on the normal blood vessels and the blocked blood vessels. Coronary arteries supply blood to the heart muscles, and coronary artery disease occurs when there is a buildup of plaque inside the artery walls. This causes decreased blood flow, and if completely blocked, it causes a heart attack. Although some people are born with certain types of congenital heart disease, most people develop cardiovascular disease because of lifestyle habits, such as eating unhealthily, smoking, and not getting enough exercise. Modifiable risk factors we are going to be discussing now. So these are factors that you can change. Now we'll start with smoking. Smokers are at a higher risk for heart disease and stroke than non-smokers. People regularly exposed to secondhand smoke are also at increased risk. The nicotine and carbon monoxide in cigarette smoke cause major damage to the cardiovascular system. Another modifiable risk factor is lack of exercise. That is an inactive lifestyle. This increases the risk for heart disease and stroke. Lack of exercise can also increase the chance of having other risk factors such as high blood pressure, high blood cholesterol, and diabetes. Unhealthy weight. Extra pounds mean extra work on your heart. This modifiable risk factor you can adjust or you can change. Unhealthy weight also can raise your blood pressure and negatively affect blood glucose levels. High blood pressure. High blood pressure increases the heart's workload and put pressure on your arteries. This pressure can cause injury, scarring, and hardening of your arteries, and eventually heart attack or stroke. High cholesterol. Total cholesterol increases the risk for heart disease and stroke. A diet high in saturated fat can increase your total blood cholesterol levels. Diabetes also increases the risk of heart disease. This risk is even greater if blood sugar is not controlled. Risk factors beyond your control. So previous discussion was risk factors that you are in control of. This one now we're going to be speaking on is beyond your control. Your age is beyond your control. Your genetic makeup is beyond your control. Your ethnicity is beyond your control. Your sex, male or female, is beyond your control. So these are things that we cannot do to change our risk of heart disease. So now we be going into symptoms of coronary artery disease. Chest pain, pressure that radiates to the arm, the jaw, neck, or back, shortness of breath, sweating, nauseousness and nausea, irregular heart rate. What is typical angina? It's substernal chest pain that is provoked by exertion or emotional stress that gets better when you rest or the stressor goes away. Most men experiences these symptoms. I'm going to be discussing now heart attack symptoms, men versus women. Men and women experience chest pain a little differently. Women tends to have more symptoms or the symptoms are different. So let's begin with men. Men, nauseousness or vomiting, shortness of breath, squeezing chest pressure, or pain in the jaw, neck, or back pain. Women also have nauseousness and vomiting, shortness of breath, chest pain, but not always, jaw pain, neck pain, and the pain is at the upper back. The pressure of the chest is at the lower part of the chest or upper abdomen. Fainting, indigestion, and extreme fatigue. Treatment of coronary artery disease. Treatment for coronary artery disease depends on the severity. In many cases, lifestyle changes, such as eating a healthier diet and exercising, can help to limit the arteries' narrow. Medications such as beta blockers, aspirin, and ACE inhibitors are used to help the heart function better once it is being damaged. In some cases, surgery and other procedures such as angioplasty may be needed. Prevention. How do you prevent coronary artery disease, or how do you prevent heart disease? Don't smoke. Manage your blood sugar. Get your blood pressure under control. Lower your cholesterol. Know your family history. Stay active. Lose weight. Eat healthy. The top healthy foods will be discussed in this slide. The keys to a healthier eating are getting plenty of whole grains in your diet, fruits and vegetables, limiting sodium intake, limiting saturated fat, and foods high in cholesterol. So, ladies and gentlemen, this was an overview on heart disease. Hope this was helpful to you and that it would help you on the way to a better health outcome and prevention of heart disease and management of heart disease. We just want to tie up with letting you know how you can also help with healthier heart disease outcome. Know your ABCs. A. Aspirin can help prevent heart attacks in individuals with heart disease, but should be under medical supervision. Do not take aspirin without medical supervision. B. Blood pressure. Managing your blood pressure is crucial. Aim for ideal readings of 120/80 to reduce heart disease risk. C. Cholesterol levels. Monitor your cholesterol levels with a target of keeping total cholesterol below 200, especially for those at risk. So you have this discussion with your medical provider. S is for smoking. Smoking cessation is essential for heart health. Various resources are available to assist in quitting. So, ladies and gentlemen, know your ABCs because these are factors that you can control. Thank you again for tuning in to our Eastern Circle Incorporation monthly health corner. We'll be have another topic in March. See you then. Thanks again. Hope this was helpful.